Hello, I'm Dr. Amna Khan, and I'm delighted to share this lecture with learners who are committed to the health of children and families. Today's topic is Fortifying the Equitable Medical Home. This brief video aims to tell the abbreviated history of Pedi Power, a physician-led health equity working group at Santa Clara Valley Healthcare in San Jose, California. Our institution is a large public healthcare system in Northern California, serving almost 2 million residents. I hope our discussion today inspires those who care for children and families to push for positive change so our youngest generation may grow up safe and healthy. A medical home is an approach to comprehensive primary care built on partnerships between patients, clinicians, and families. It extends beyond clinic walls to include coordination with specialists, schools, community resources, and family support systems. The care provided should be patient and family-centered, comprehensive, continuous, compassionate, coordinated, and accessible. We believe quality healthcare is a basic human right, and every child deserves a medical home. While not all children will need hospitalization or specialty care, all of them need a reliable source of trusted medical guidance to prevent and treat illness. We aim to be partners within our community, helping children reach their full potential, regardless of the circumstances into which they were born. Pedi Power practices targeted universalism, setting universal goals for all children while recognizing that different specific approaches are needed to achieve equity. Not all children are born into the same circumstances or opportunities, though their potential is equal. We use this framework to build an equitable medical home for every patient and family we serve. Our work aligns with the equity agenda established by the American Academy of Pediatrics, addressing systemic racism in pediatric medicine through 5 key areas: community advocacy, research, provider and patient education, clinical practice, and workforce development. We don't just expand our equity-centered knowledge, we take the next step, creating tangible interventions that improve the specific circumstances our patients and families face. The following examples demonstrate this principle in practice. Our first urgent intervention arose from watching the parents of our patients fall ill with COVID-19, many working public-facing jobs that put them at heightened risk every day. We needed to effectively communicate our strong endorsement of COVID vaccination to adults in our community, but no Spanish language signage was available. We created our own multilingual graphics campaign, designing buttons, shirts, and posters in both English and Spanish that staff wore throughout the Santa Clara Valley Health Pediatrics outpatient campus. This ensured that every family, regardless of language, received a clear, consistent message: we care about your health, and we want to help protect you. This intervention emerged directly from listening to patient voices and stories in our clinic, a response to an urgent need we witnessed firsthand. It was low cost and high creativity, demonstrating that starting small can create meaningful impact when you think big about the possibilities. We care for all people, regardless of immigration status, religion, sexual orientation, gender identity, income, or education level. And during this current political administration, we have become more vigilant about protecting our patients facing deportation concerns and family separation. We provide red card information and legal counsel resources to every patient we see in clinic, without documenting immigration status and medical charts that could potentially be used against them. We counsel families on creating safety plans for mixed status households and offer free community events to help develop these plans. We are only beginning to understand how these policies will impact healthcare access and the potentially devastating effect on our community's health, both locally and nationally. Over the next few moments, we'll share current equity interventions that Pedi Power has initiated and is working diligently to advance within our patient population. One of the most egregious health inequities in our country and in California is the disparity in pregnancy-related morbidity and mortality. Black and American Indian mothers face the highest risk of both life-threatening complications and death associated with pregnancy. These infographics illustrate the crisis In California, Black mothers experience significantly higher pregnancy-related mortality than Asian, white, and Latinx mothers. Similarly, rates of severe maternal morbidity or life-threatening complications are highest among Black patient populations. 50% of these adverse outcomes occur postpartum. This reality prompts us to ask, how can we as pediatricians, who see new mothers 2 to 4 times in the first weeks of their baby's life, help protect mothers too? We've partnered with our OB colleagues to develop specific questions about mothers' physical and mental health that we ask at newborn visits. Since implementing these screenings, I've personally connected many mothers to urgent medical care they desperately needed, but would have struggled to access before their 6-week postpartum appointment. This gives mothers an alternative to busy emergency rooms where long wait times and illness exposure put vulnerable newborns at risk. Food insecurity, insufficient access to nutritious, affordable food, is a growing crisis in our community. The rising cost of living, inflation, and loss of federal COVID subsidies have left many community members hungry. Federal nutrition programs like WIC and SNAP, also known as CalFresh in California, provide critical support for children's physical health, mental health, and academic achievement. Many families feel stigma about acknowledging food insecurity, or parents skip meals to feed their children. Whenever a family in clinic mentions struggling to pay for rent, gas, diapers, or school supplies, we immediately connect them to social work and food resources, the fastest way to free up financial resources for other essential needs. Pedi Power developed a specialized referral system that connects families directly to our Second Harvest food bank. Instead of families having to reach out themselves, Second Harvest contacts them to understand their specific needs and identify the most accessible and reliable food distribution sites. This simple change transforms a passive referral into an active one, removing barriers so families receive food resources quickly and reliably. Book Power is a summer reading and activities program designed to combat summer slide, the loss of academic skills when children are out of school. In our county, a higher percentage of Black and Latinx students are not meeting third-grade reading standards. Many of our pediatric patients cannot afford summer camps or enrichment programs and spend their summers on screens while parents work. Book Power kits include age-appropriate books celebrating diverse communities. Older children receive graphic novels or books that reflect their own backgrounds and respond with incredible joy. Kits also include art supplies, information about using student IDs as library cards, farmers market coupons, details about free YMCA and fitness center memberships throughout our insurance plan, and through our Park Power partnership with Santa Clara Public Health, free parking passes to county-maintained local parks. Every child and family deserves access to books, enrichment, and safe green spaces during the summer. To best care for our diverse patient population, we must educate ourselves on their histories and socio-political struggles in their own words. Over nearly 5 years, we've committed to reading together, always asking, how does this new knowledge change our clinical practice? Every book we read and discuss deepens our understanding of our patients' lived experiences and helps us deliver more compassionate, comprehensive care that honors those experiences. Fortifying the equitable medical home requires community partnership. All the work described here emerged through collaboration. It could never be as comprehensive or multifaceted if confined to our own medical institution alone. We call this our health equity ecosystem, and it grows with each new intervention we pursue. These partnerships have allowed us to think bigger about impact and discover novel solutions to our most challenging clinical questions about equitable care. They enable us to go deeper into equity work, step by step. Our co-collaborators also affirm the importance of this work and remind us we're part of a larger team committed to the same principles. This fortifies us as change makers and brings beautiful color and depth to our work over time. I'll leave you with 3 levels of action to consider for yourself. Level 1, learn. Commit to deepening your knowledge in one area of equity. Perhaps something in this presentation has inspired you to learn more about a specific principle or intervention. Level 2, Act. Convert what you've already learned into action. Bring an expert speaker to your organization or implement one small change that makes your practice more accessible, whether through language access, reduced financial barriers, or another equity-focused improvement. And level 3, collaborate. Find a partner and create a team. Collaboration sustains and invigorates equity work. When we align with others who share our goals, we make the biggest impact. Working together makes changes possible and sustainable into the future. Thank you for your time and attention in listening today.